Why is diverticulitis abscess drainage a complex procedure? Imagine trying to drain a pocket of infection deep inside the body, near vital organs and major blood vessels. That's what makes diverticulitis abscess drainage a highly intricate process. These abscesses often form in hard-to-reach places within the abdomen or pelvis, sometimes hugging important arteries and veins. Because of this close proximity, there's a real risk of damaging blood vessels during the procedure, which could cause serious bleeding or other vascular problems. To avoid this, doctors relying heavily on imaging techniques like computed tomography scans or ultrasound guidance to carefully navigate and pinpoint the abscess without harming surrounding structures. Another challenge is the risk of spreading infection during drainage. When the infected fluid is released, bacteria could escape into nearby tissues or even enter the bloodstream, leading to sepsis. Patients with diverticular abscesses are already vulnerable to this dangerous complication, so the procedure must be performed with extreme caution and close monitoring. The technical aspect also adds to the complexity. Different methods, such as using a needle and guidewire or inserting a larger catheter, each have their own risks. Ensuring the catheter stays in the right place is crucial. If it moves or becomes blocked, drainage might be incomplete, which can prolong infection or cause further issues. Preparation is another important factor. Patients often need blood tests to check their clotting ability and may have to stop blood-thinning medications beforehand to reduce bleeding risk. Sedation and antibiotics are also carefully chosen to keep the patient safe and infection under control. Timing is critical too. Not every abscess needs drainage. Small ones might be managed with antibiotics alone, so clinicians must decide whether to drain or continue conservative treatment based on size and symptoms. Larger abscesses, usually those over 3 centimeters, often requiring drainage, but even after successful procedures, some patients might need surgery later if the infection persists or recurs. Complications can happen despite careful planning. Bleeding, injury to nearby organs, catheter problems, or failure to fully drain the abscess are all possible. Sometimes, multiple procedures or surgeries are needed to fully resolve the issue. Because of these factors, managing diverticulitis abscesses requires a team of skilled healthcare professionals, thorough patient assessment, and vigilant follow-up care. Ultimately, the complexity stems from navigating difficult anatomy, managing serious infection risks, performing technically demanding procedures, and making nuanced decisions about treatment timing. This careful approach helps ensure the best possible outcome while minimizing risks for the patient. Always remember, anyone facing this should consult experienced medical teams to tailor treatment to their specific situation.